Colonoscopy versus stool-based testing for colorectal cancer screening. Which one should I have? Which one is better? So stool-based testing refers to those tests such as FIT tests or Cologuard tests. These are the tests that basically detect hemoglobin in your stool. Microscopic blood in your stool is not something you would see visually, and you can do it basically from the comfort of your home. It does not require a bowel preparation, and it does not require an anesthetic like a colonoscopy would. So it's very convenient. These tests, however, have to be done every 1 to 3 years, and they are detection tools. Okay, so if you have a positive FIT test or a positive Cologuard test, you will have to follow that with a colonoscopy in order to see if you have any polyps, and those polyps then need to be removed with a colonoscopy. The colonoscopy remains the gold standard because it's both a detection test but also a prevention test, right? We would detect precancerous polyps during the colonoscopy and at the same time remove them. Yes, it does take sedation. Yes, it does take a bowel operation. However, if it's normal, you do have a long screening interval. So we do it every 10 years. So for basically a healthy adult that can tolerate a colonoscopy, this is the better test for, again, detection, but also prevention. If you are a patient that for some reason cannot tolerate anesthetics related to colonoscopy because of medical problems, or you simply don't want to have a colonoscopy, then definitely I would use the stool-based testing as your screening option. And remember that any screening is better than no screening.